If you have diabetes or your blood sugar has been harder and harder to control lately, I need you to stop for just one moment before you do anything else. Before you blame carbs again, before you consider adjusting another medication, before you cut out another food you actually enjoy. I need you to pay close attention to something that most doctors never bring up in a routine appointment. Something that has been quietly working against you, possibly for years, without you ever knowing it was happening. Because right now, while you are watching this, there is very likely something happening inside your body that has nothing to do with how disciplined you are, how carefully you are eating, or how hard you are trying to manage this disease. Think about how your body has felt over the last several months. The exhaustion that hits after meals, even when you eat something that seemed completely reasonable. The cravings that show up out of nowhere, even after you have already eaten a full meal. The burning sensation in your feet late at night that makes it hard to fall asleep and stay asleep. The muscle cramps that jolt you awake at 2 or 3 in the morning. The mental fog that makes it feel like you're thinking through a thick layer of cotton. The mornings where you wake up feeling every bit as tired as when you went to bed, no matter how many hours you actually slept. The low moods, the irritability, the feeling that your body just is not responding the way it used to, no matter what you do. I want you to sit with that list for a second, because I want you to understand something critical before we go any further. Those symptoms may not be happening because you are failing at managing your diabetes. They may not be happening because you lack willpower, or because you are making bad choices, or because you simply are not trying hard enough. They may be happening because your body is slowly being drained of the exact minerals that insulin physically needs in order to do its job properly inside your cells. And the part that makes this so dangerous and so incredibly easy to miss is this. It can be happening even when your glucose numbers look relatively controlled on paper. You can be bleeding out these critical minerals at the cellular level while your A1C sits in a range that does not immediately set off alarms. And all the while, you are feeling worse and worse, with less and less of an explanation for why. That is why today, I am going to walk you through the 3 hidden mineral deficiencies that quietly and consistently make diabetes worse over time. I am going to explain clearly and in plain language exactly why most people never realize this is happening to them until significant damage has already been done. And I'm going to show you why addressing these deficiencies consistently and with the right approach can genuinely change the way your body responds to insulin, the way your energy feels throughout the day, the way inflammation behaves inside your blood vessels and nerves, and even the intensity of your cravings and your ability to get deep, restorative sleep. One of these deficiencies is so common in people with diabetes that researchers keep finding it in study after study across different countries and different patient populations, yet almost nobody brings it up at a routine checkup. It does not make the highlight reel. It does not come with a prescription. And because it does not, millions of people are walking around with a deficiency that is actively making their diabetes harder to manage, and they have no idea. So stay with me all the way through this video, because the final mineral on our list, the number 1 deficiency I want to talk about today, is the one most people overlook completely. And I believe it may be the most important one of all for how your body feels every single day. I am Dr. Megan Foster, and after more than 2 decades of working directly with patients dealing with metabolic disease, vascular problems, nerve damage, and the long-term complications of diabetes, I can tell you something with full confidence that most people are never told early enough in their journey with this disease. Diabetes is not simply a blood sugar disease. That is the mainstream clinical focus. Track your glucose, reduce your carbohydrates, take your medication. And while those things absolutely matter and should not be abandoned, they only address part of what is actually happening inside the body. They manage the visible surface of the problem while the deeper cellular story continues to unfold underneath. Underneath the surface, at the level of your individual cells, something else is going on. Your body is steadily losing the very nutrients that insulin depends on to function the way it should. And when those nutrients drop, the whole system begins to weaken in ways that show up as symptoms, sometimes years before they show up as serious lab abnormalities or formal complications. Symptoms that most people end up attributing to aging or stress or just the nature of having diabetes, when in reality, they are the body's distress signals asking for something specific that it is not getting. When these minerals become depleted, insulin signaling weakens at the receptor level. Inflammation begins to rise throughout the body, particularly in the blood vessels and peripheral nerves. Those nerves become more vulnerable to damage. The blood vessels that carry oxygen and nutrients to your tissues gradually stiffen and lose flexibility. Energy production at the cellular level slows down because the enzymes responsible for generating that energy cannot work without adequate mineral support. And the cumulative result is that some people end up doing everything they are supposed to be doing, monitoring their numbers, taking their medications, trying to eat well, exercising when they can, and still feeling worse every single year. Not because they are not trying hard enough, not because this disease is simply unwinnable, but because nobody ever explained the deeper cellular picture of what diabetes does to the body over time and what the body actually needs in order to fight back effectively. This is what I want to give you today. Not fear, not a list of things you are doing wrong, but understanding. Because understanding the real picture is the first step toward actually changing it. Let me take you back for a moment. Maybe a few years ago, before things started feeling this way, life with diabetes was a little more manageable. You could eat a meal and still have reasonable, stable energy afterward. Your sleep felt deeper and more restorative, and you woke up feeling like you had actually rested. Your body bounced back faster from physical exertion. Your legs did not ache and burn at night. Your cravings were not constant and overwhelming. Your mind felt clearer and sharper. Small problems did not drain you completely. You felt like you had some capacity in reserve. And now you notice the shift. You feel drained after eating, even when you make careful choices. Your feet tingle or burn in the evening in a way that interrupts your sleep and your focus. Small cuts and scrapes seem to take longer to heal than they used to. Your energy crashes at random times with no clear cause. The mental fog shows up on days when nothing particularly stressful has happened. Your body just feels more fragile overall. Not dramatically, not all at once, but quietly, steadily, in a way that is easy to explain away as just getting older or having a hard week or just the nature of this disease. That quiet, gradual shift is exactly why so many people with diabetes miss what is actually happening in the early stages. Because mineral depletion does not feel like one dramatic event with a clear timestamp. It feels like your body slowly becoming harder to manage. Like the tools you have always relied on are becoming less effective over time. Like you are doing the same things you used to do and getting less back from them. But here is the critical thing I need you to understand, and I want you to really hear this. This was not automatically supposed to happen to you. This is not simply the unavoidable and inevitable result of aging or of having diabetes. It is not proof that decline has a fixed trajectory that you have no power to influence. A lot of people are told, sometimes directly and sometimes indirectly, through the framing of their medical appointments, that worsening fatigue, increasing nerve discomfort, stronger cravings, poor sleep, and unstable energy are just a natural and expected part of living with this disease. That this is what diabetes looks like over time, and there is not much to be done about the trajectory. But that is not the complete and honest picture, because when the body becomes depleted at the cellular level, symptoms start appearing long before the major structural complications do. And in many cases, addressing these deficiencies consistently and early can dramatically improve how a person feels day to day, not overnight, not through some shortcut or miracle, but through real targeted biological support that the body genuinely needs and can actually use. And once you understand what is happening underneath the surface, so much about managing this disease starts to make a whole lot more sense. You start to see why some approaches work and others do not. You start to understand what the body is actually asking for when symptoms show up. And you start to realize that you are not powerless. Here's the simplest way I know how to explain the core problem we are dealing with. Think of insulin as a key. Its entire job is to unlock the door to your cells so that glucose, which is your body's primary fuel source, can move out of the bloodstream and into the cell where it gets converted into energy you can actually use. When insulin is working well and when the cellular environment is properly supported, glucose moves efficiently, blood sugar stays more stable, and you feel better. That is the system working as intended. Now think of minerals like magnesium, zinc, and chromium as the oil inside the lock mechanism itself. Without enough of that oil, the lock becomes stiff and resistant. The key does not turn smoothly. The door stops responding the way it should. Insulin is still there. It is still trying to do its job, but it cannot work efficiently because the internal environment it depends on has broken down at the most fundamental level. The machinery is not broken in an obvious, dramatic way. It is just running without the lubrication it needs, and that friction compounds over time. And then there's the second layer of the problem, which is where it becomes a true self-reinforcing cycle that most people never escape without directly addressing it. High blood sugar causes the kidneys to work overtime to filter out the excess glucose from the bloodstream. They do this by flushing it out through urine, which is why frequent urination is such a common symptom of uncontrolled diabetes. But every single time that process happens, minerals get pulled out of the body right along with the excess sugar. The kidneys cannot easily separate the minerals from the fluid being eliminated. So now the body is actively and continuously losing the exact nutrients that insulin needs in order to function properly. Higher blood sugar leads to more mineral loss. More mineral loss leads to weaker and less efficient insulin function. Weaker insulin function makes blood sugar harder to control, which leads to higher blood sugar. And the cycle continues, getting harder to break with each rotation. Most people with diabetes are never taught that this loop exists. It is not part of the standard conversation about managing the disease. But once you see it, once you understand that these two systems are directly connected and affecting each other, so many things start to connect. Why some people feel like they're treading water no matter how hard they try. Why symptoms keep building even when glucose numbers seem okay. Why energy and sleep and nerve health seem to worsen in tandem. And this is not just a theory or a framework I have developed in clinical practice. This is documented in the research literature. Large studies on metabolic disease have repeatedly and consistently shown that people with diabetes have significantly lower levels of magnesium, zinc, and chromium compared to people without the disease. That is not a small or isolated finding. It shows up across different research institutions, different geographic populations, and different study designs. Researchers specifically studying insulin resistance have found strong recurring associations between low magnesium levels and worsening insulin sensitivity, rising markers of inflammation, and significantly increased risk of cardiovascular complications. Long-term studies have connected zinc deficiency in people with diabetes to poorer glucose control over extended periods of time, increased cellular damage from what researchers call oxidative stress, meaningfully slower wound healing, and worsening of the complications that affect the kidneys, the eyes, and the peripheral nerves. And chromium has been studied for decades, specifically because of the role it plays in how the body processes glucose and how efficiently insulin communicates its signal to the cells that are supposed to respond to it. The same pattern keeps showing up across study after study. When these mineral systems are depleted, blood sugar regulation becomes significantly harder to maintain, and the effects extend far beyond glucose numbers alone. So, today we are going to walk through the three most important mineral deficiencies that every person with diabetes needs to understand and take seriously. We are going to go from the third most commonly discussed to the second, and then to the number one mineral, which I genuinely believe may be one of the most overlooked factors in why so many people with diabetes feel stuck, despite doing everything that has been recommended to them. And I want to say something before we get into the first one, because I think it matters. If you are watching this video right now and you have been feeling like you are struggling more than you should be, like you are working hard and still not seeing the results you expect, like something is off, but nobody has been able to tell you exactly what, I want you to know something important. You are not alone in that experience. This is one of the most common things people describe when they talk about living with diabetes long term. They feel isolated by these symptoms. They wonder if there is something fundamentally wrong with them, something they cannot fix or change. They blame themselves. Aim, it is not that. And I would love to know in the comments right now, what has been the hardest symptom for you lately? Is it the constant low energy that never really goes away? The cravings that feel impossible to resist even when you know better? The sleep that never feels like enough? The burning or tingling in your feet that nobody seems to have a good answer for? The brain fog that clouds your thinking even on good days? Drop your answer below, because when you do, you will almost certainly find that many other people watching this are dealing with the exact same experience. That shared experience matters. It matters more than most people realize. Now let us get into the first mineral. The third mineral on our list today is chromium. And I want to be straightforward with you. Most people with diabetes have never given chromium a second thought. The common assumption, even among some healthcare providers, is that chromium is just a minor trace mineral, something that exists in the background of nutrition science without having a major clinical impact. That assumption, based on the available evidence, is not accurate. Chromium plays a very direct and well-studied role in helping insulin move glucose out of the bloodstream and into the cells where it can actually be used. The way I like to explain it to my patients is this: think of chromium as insulin's assistant. Insulin sends the signal, but chromium helps amplify and carry out that signal at the cellular level. When chromium levels are adequate, insulin can do its job more efficiently. When chromium is low, insulin becomes less effective at opening that cellular door, and blood sugar stays elevated for longer stretches after meals. Research on chromium and glucose metabolism has consistently shown meaningful improvements in how the body handles insulin in people whose chromium status was poor to begin with. That is an important nuance. The effect is most significant in people who are actually deficient, which, as it turns out, includes a large proportion of people with type 2 diabetes. And the reason people with diabetes specifically tend to run low in chromium connects directly back to what we discussed about the depletion cycle. The kidneys, working overtime to clear excess blood sugar from the bloodstream, pull chromium out of the body along with it. So the more frequently blood sugar spikes, the more chromium gets lost. And the more chromium gets lost, the harder it becomes to control those spikes. It is the same self-reinforcing loop playing out through a different mineral. The best food sources of chromium are practical and, for the most part, easy to access. Broccoli is actually one of the richest natural sources of chromium available, which is one of many reasons why it keeps showing up in discussions of foods that support metabolic health. Brazil nuts are excellent and easy to eat as a snack. Eggs are a reliable everyday option that provide chromium alongside a wide range of other nutrients. Lean beef delivers a meaningful amount. And asparagus is another food that most people would never guess is a solid source of this mineral. Now, here's the mistake I see people make repeatedly when it comes to chromium, and it is a pattern worth understanding clearly. People try to support their chromium levels through supplements or by adding chromium-rich foods, while still eating a diet that is heavy in highly processed foods and refined carbohydrates. And the fundamental problem with that approach is that processed sugar and refined carbohydrates are among the biggest chromium depleters in the modern diet. Every time those foods trigger a significant blood sugar spike, they activate that kidney flushing cycle and more chromium leaves the body. You are filling a bucket with a hole in the bottom. No supplement in the world will fully compensate for a dietary pattern that is constantly pulling chromium back out faster than you can replace it. The food environment has to change alongside any supplementation strategy for the strategy to actually work. And now, the second mineral we are going to talk about affects far more than blood sugar alone, far more than most people realize. The second mineral on our list is zinc. Most people associate zinc primarily with immunity. You have probably seen it marketed for cold prevention or as something to take at the first sign of getting sick. And while zinc does support immune function, that is honestly only a small fraction of its role in the body and an even smaller fraction of its specific relevance for people with diabetes. Zinc is deeply involved in insulin production, nerve protection, wound healing, inflammation control, testosterone production in men, and even the health of the retina in the back of your eye. That last point is particularly relevant for people with diabetes because diabetic retinopathy, damage to the small blood vessels supplying the retina, is one of the leading causes of vision loss in this population. Here is something that genuinely surprises many of my patients when I explain it. Your pancreas, the organ responsible for producing insulin, actually uses zinc to properly package, store, and then release insulin into the bloodstream in the right amounts at the right times. Without adequate zinc, the process of handling and releasing insulin becomes less efficient from the very beginning, before insulin even has a chance to reach the cells it is supposed to signal. People with diabetes tend to notice the signs of zinc deficiency in very recognizable and specific ways once they know what to look for. Cuts and scrapes that take noticeably longer to heal than they used to. Skin that becomes increasingly dry, rough, or prone to cracking. Cravings that feel more intense and harder to push back against. Hair that seems to thin or fall out more than it should. Energy levels that drop and stay low without a clear explanation, and nerve discomfort that worsens progressively because zinc plays a direct protective role against the kind of cellular damage to nerve fibers that accumulates from ongoing oxidative stress. Large observational studies have consistently linked lower zinc levels in people with diabetes to poor long-term glucose control and to worsening of the complications that affect the kidneys, eyes, and peripheral nerves. This is not a marginal or disputed connection in the research. It shows up repeatedly across populations. The best food sources of zinc include oysters, which are genuinely one of the most zinc-dense foods that exist in the human diet by a significant margin. Beef is a reliable and practical everyday source for most people. Pumpkin seeds are excellent and easy to add to meals or snacks without any real effort. Lamb is another strong option. Chickpeas work well for people who eat a more plant-focused diet, though the zinc from plant sources is somewhat less efficiently absorbed than from animal sources. And eggs continue to show up on these lists because they genuinely provide a wide range of important nutrients in a form the body handles well. If supplementation is something you are considering or discussing with your doctor, the form of zinc matters considerably. Zinc picolinate and zinc glycinate are generally absorbed much more effectively by the body than the cheaper zinc oxide form you find in many budget supplement products. That difference in absorption is genuinely meaningful, especially when the goal is to actually correct a meaningful deficiency rather than just technically consuming a supplement that mostly passes through without being used. And here's a pattern I want to highlight because it comes up so frequently in conversations with people managing diabetes, and I think it deserves direct attention. A lot of commercially marketed diabetic food products, the ones specifically labeled and positioned for people with blood sugar concerns, are technically lower in sugar or in glycemic impact. And that can seem like a meaningful benefit on the surface. But many of these products have been processed in ways that strip out the real nutritional content. They are lower in sugar and also lower in zinc, magnesium, chromium, and essentially every other micronutrient that the body needs to function well. And that is a dangerous long term trade off that rarely gets discussed in the marketing around these products. Lower sugar does not automatically mean nutritionally supportive. When you are choosing foods, nutritional density matters just as much as, and sometimes more than, the carbohydrate count alone. Now we are getting into what I consider to be the most important part of this conversation. Because the final mineral on this list, the number one deficiency I see in people with diabetes, may be one of the single most powerful hidden drivers of insulin resistance, chronic fatigue, disrupted sleep, persistent muscle tension, and worsening nerve discomfort. And once people correct it in a consistent and sustained way, over weeks and months rather than overnight, some notice changes in how their body feels at a fundamental level more quickly than they expected. This is the mineral where people describe something shifting in how they feel that goes beyond any single symptom. They describe it as finally feeling calmer from the inside. Their sleep becomes deeper and more restorative, and they start waking up actually feeling rested. Their muscles feel less tight, less prone to cramping, more able to relax fully. Their cravings become quieter and more manageable. Their energy feels more steady and reliable throughout the day rather than peaking and crashing. Their heart does not feel like it is racing or doing something uncomfortable when they lie down at night. Their mind feels less cluttered and more present, not because of hype, not because of marketing language or exaggerated claims, but because this mineral is involved in literally hundreds of biochemical reactions throughout the body, reactions that directly affect how the nervous system operates, how muscles contract and release, how blood vessels behave under pressure, and critically, how sensitively and effectively insulin receptors respond to the insulin signal they are supposed to receive. That mineral is magnesium. Magnesium may be the single most important mineral that people with diabetes are commonly deficient in, and the misconception surrounding it is genuinely widespread and genuinely harmful. Most people have only heard of magnesium in the context of muscle cramps or sleep, as something you take if your legs cramp at night or if you are having trouble winding down. That connection is real, but it represents only a tiny fraction of what magnesium actually does throughout the body. Magnesium is required for insulin receptors to respond properly to the insulin signal. When you do not have enough magnesium in your system, the insulin receptor, which is the specific molecular structure on the surface of your cells that is supposed to recognize insulin and trigger the opening of the glucose channel, becomes less sensitive and less responsive. It does not react as quickly or as completely as it should, and the result is worsening insulin resistance. Not because your insulin production has necessarily changed, not because you are eating worse than before, but because the cellular machinery that processes the insulin signal has lost a critical component. It needs to function the way it was designed to. When magnesium is consistently insufficient, blood sugar stays elevated for longer stretches after meals because the cells are not absorbing glucose efficiently. Inflammation rises throughout the body, and particularly within the walls of blood vessels. Those blood vessels become progressively stiffer and less flexible, which increases strain on the heart and raises cardiovascular risk, which is already elevated in people with diabetes. Nerves become more irritable and more prone to the kind of persistent discomfort and pain that so many people with this disease struggle with. And energy production at the mitochondrial level, which is where your cells actually generate the energy that powers every function of your body, slows down significantly because many of the enzymes involved in that process depend on magnesium as a cofactor. And just like with chromium and zinc, high blood sugar accelerates the loss of magnesium through the urine. People with diabetes are caught in the exact same vicious depletion cycle. The higher the blood sugar, the more magnesium gets flushed out. The less magnesium there is, the harder it becomes to control blood sugar. Left unaddressed long enough, this cycle creates a state of chronic magnesium deficiency that makes insulin signaling profoundly difficult to stabilize despite ongoing treatment efforts. Some research has found associations between low magnesium status and higher rates of cardiovascular disease, more severe insulin resistance, poorer long term glucose control as measured by markers like HbA1c, and a greater likelihood of developing the serious complications of diabetes that affect the kidneys, eyes, and nerves. These are not marginal findings sitting at the edges of the research. They appear consistently in the metabolic medicine literature and represent a pattern that is hard to ignore. So, where do you get more magnesium through food? Because food always comes first before supplementation, and food based magnesium is generally better tolerated and more easily regulated by the body than supplemental forms. Pumpkin seeds are one of the best sources of magnesium available and are genuinely easy to work into everyday meals, whether sprinkled on a salad, added to a snack, or mixed into something you are already cooking. Dark leafy greens like spinach are rich in magnesium and widely accessible. Almonds are another excellent and practical option that most people can realistically include on a daily basis without significant effort or expense. Avocados provide magnesium alongside healthy fats that also support blood vessel function and inflammation control. Dark chocolate with a high cocoa content, specifically 70% or higher, provides meaningful amounts of magnesium, along with other compounds that support circulation and heart health. And fatty fish, like salmon, mackerel, and sardines, deliver magnesium alongside the omega-3 fatty acids that protect the heart and help regulate the inflammation that drives so many diabetic complications. If you are considering a magnesium supplement after discussing it with your doctor, the form you choose matters enormously and is worth understanding before you spend money on something that may not work well for you. Magnesium glycinate and magnesium bisglycinate are generally the best tolerated and most efficiently absorbed forms available. They tend not to cause the digestive discomfort that some other forms produce, and they are absorbed in a way that allows more magnesium to actually reach the cells that need it. Magnesium oxide, which is the form you most commonly find in inexpensive grocery store supplements, has very low absorption rates. A significant portion of it simply passes through the digestive system without being used. This means you may be taking a supplement, paying for it, and experiencing the inconvenience of it, while not actually correcting the deficiency in any meaningful way. If you are going to invest in a magnesium supplement, choosing a more bioavailable form is genuinely worth the slightly higher cost. But here is the most important practical point I want to make about magnesium and about all three of these minerals, and it is something I think is worth spending real time on rather than rushing past. Taking a supplement while continuing the habits that drain these minerals every single day will only get you so far, and in some cases will not get you very far at all. High sugar intake pulls magnesium out of the body through the kidney flushing mechanism we have already discussed. Excess alcohol is a well-documented magnesium depleter that many people do not realize is working against them. Highly processed diets are stripped of the mineral content that whole foods would naturally provide, and some of the additives in processed foods actively interfere with mineral absorption. Chronic stress, which is something an enormous proportion of people with diabetes deal with, because of the psychological and emotional weight of managing a chronic disease indefinitely, is one of the most powerful magnesium depleters that exists. The primary stress hormone, cortisol, actively promotes the excretion of magnesium through the kidneys. Every time the stress response is activated significantly, magnesium gets pushed out. Poor sleep creates its own cycle in relation to magnesium. Low magnesium disrupts sleep quality, particularly the deep restorative stages of sleep. And poor sleep itself further depletes magnesium because sleep deprivation elevates cortisol, which then drives more magnesium out. So, people who are not sleeping well because of magnesium deficiency often find their magnesium levels dropping further because they are not sleeping well. That cycle is very real and very common in people with diabetes. The lifestyle context surrounding supplementation matters just as much as the supplement itself. Supporting magnesium levels effectively is not simply a matter of adding a pill to your routine. It is an approach to how you eat, how you manage and recover from stress, how you protect the quality of your sleep, and how consistent you are over time. Gradual, sustained improvement across all of those areas is what actually moves the needle. One pill taken inconsistently while everything else stays the same tends not to produce the kind of results people hope for. Now, I want to say something important and direct before we move to the final section of today's conversation, and I want you to hear this clearly. Please do not take the information in this video and immediately go out and purchase the largest doses of every supplement I've mentioned. More is not always better. In many cases, in terms of mineral supplementation, more is actively harmful to certain people. This is especially and critically true if you have any degree of kidney disease, which is unfortunately common as a complication of diabetes. The kidneys are responsible for filtering excess minerals out of the bloodstream. And if kidney function is already compromised, taking high doses of supplemental minerals can lead to dangerous accumulations. It is also important to consider if you are taking medications, because some minerals interact with specific drugs in ways that affect how those drugs are absorbed or how they work in the body. The smarter, safer, and ultimately more effective approach is gradual and consistent rather than dramatic and extreme. Start with food quality first before anything else. Improving what you eat consistently every day provides minerals in forms the body is designed to absorb and regulate. Add mineral-rich whole foods to your regular eating pattern in practical and sustainable ways. Make sure you are hydrating adequately throughout the day because proper hydration supports kidney function and helps maintain mineral balance. And if you decide to consider supplementation after doing that foundational work, do so thoughtfully, at appropriate doses, and ideally in conversation with your doctor or a registered dietitian who has experience with metabolic health. Slow, steady, consistent support almost always produces better and more lasting results than dramatic changes made in a burst of motivation that are difficult to sustain. The body responds to consistency over time. That is how biological systems work. Now, let me bring all of this together because I think there is a bigger picture here that is genuinely worth sitting with for a moment before we close. A lot of people with diabetes are working genuinely hard to manage their disease. They are monitoring their blood sugar. They are trying to make better food choices even when it is difficult and expensive and socially complicated. They are taking their medications consistently. They are exercising when their energy and their body allow it. They are doing everything they have been told to do. And yet they feel stuck. They feel like they are treading water, or worse, slowly losing ground, despite every effort. Like something fundamental is not adding up. Here is what I believe is often happening in those situations. They are managing the surface of the problem while their body is running in a profoundly depleted state underneath. And that changes everything about what is possible. Because insulin does not work in isolation from the environment it operates in. It works within an entire biochemical ecosystem that requires specific nutrients to function. Your nerves do not heal in isolation. Your blood vessels do not maintain their flexibility and responsiveness in isolation. Your cellular energy systems do not operate efficiently in isolation. All of these systems are connected, and they all depend on having adequate amounts of the basic raw materials they need to work. Magnesium, zinc, and chromium help regulate the entire environment that insulin depends on. They support the conditions in which the body can actually respond to treatment, to lifestyle changes, to the medications that have been prescribed. And when that environment starts to improve, when those depleted foundational systems begin receiving what they have been missing, the body often becomes significantly more responsive and resilient. Not always dramatically, not always immediately, but biologically and meaningfully in ways that compound over time. That is why some people feel stuck for years despite genuinely trying harder and harder at the surface level. They have been working against symptoms without rebuilding the foundation that those symptoms are emerging from. And once that foundation starts to be restored, things begin to shift in a way that effort alone at the surface level simply cannot produce. So here is what I want to encourage you to do. Not next week, not when you feel more ready or more motivated. Right now, today, starting with your very next meal. For the next 30 days, commit to adding at least one mineral rich food to your daily eating. Not a complete dietary overhaul, not a transformation that requires throwing out everything in your kitchen and starting over. Just one intentional addition each day, one food that moves the needle in the right direction. Maybe it is a small handful of pumpkin seeds with your breakfast. Maybe it is adding a serving of spinach to something you're already eating for lunch. Maybe it is choosing eggs one morning instead of something more processed. Maybe it is including some almonds as an afternoon snack instead of reaching for something that would spike your blood sugar. Maybe it is a piece of salmon for dinner, or some broccoli on the side, or an avocado sliced over whatever you are already eating. These are practical, accessible, affordable foods that most people can genuinely incorporate without a huge disruption to their existing routines. And then pay close attention to your body over those 30 days, not just to your glucose numbers, because we are looking at a broader picture of health than any single data point can capture. Pay attention to your energy levels from morning to evening. Notice whether your cravings feel different in intensity or frequency. Track how well you are sleeping and how you feel when you wake up. Observe whether the tension in your muscles eases. Pay attention to how your body feels after meals. Notice any changes in the nerve sensations in your feet or legs. Because when the body starts receiving what it has been missing at a foundational level, the changes people experience often extend far beyond what any single lab number would show. And those subjective changes in how you feel every day matter enormously, perhaps more than any single data point, because they represent the actual quality of your life with this disease. And I want to leave you with something I say to almost every patient who comes to me feeling discouraged and overwhelmed by diabetes. Something I genuinely mean and believe based on everything I have seen over more than 20 years of working with people in this situation. Your body is not broken. I know it can feel that way, especially when you're trying hard and still struggling, especially when symptoms keep accumulating, especially when it seems like no matter what you do, the disease is always one step ahead of you, especially when the people around you do not fully understand what it feels like to manage something this demanding every single day. But worsening symptoms are not always proof that decline is inevitable or that nothing can be done. In many cases, those symptoms are the body's way of signaling clearly that something it critically needs has been missing for too long. The body is not failing arbitrarily. It is responding to a specific deficit in a predictable way. And when that deficit is addressed, the response is also predictable. Many people with diabetes have simply never been given the complete picture. They were told about blood sugar and carbohydrates and medication, and those are all important.